ožujku 2020. godine svijet je stao. Maske, lockdown, strah. Rekli su nam da je to novo normalno. Godinu dana kasnije stigla su cjepiva, brže nego ikad u povijesti medicine. Rekli su da su sigurna i učinkovita, da je znanost završila svoje. Ali što ako nije? Što ako su neka pitanja ostala bez odgovora? Ili su možda odgovori bili previše neugodni za izgovoriti? U ovom razgovoru kirurg i milijarder doktor Patricka Soon-Shionga, tvorac jednog od najpoznatijih lijekova za rak, otvara Pandorinu kutiju, govori o T-stanicama, o imunološkom sustavu, o nečemu što naziva terorističkim rakom. Ovo nije teorija zavjere, ovo su riječi čovjeka iz samog srca medicinskog establishmenta, ali kome još možemo vjerovati kada su u igri milijarde dolara i milijuni života? Dobrodošli u oblak sumnje, gdje pitanja tek počinju.
Wait, so is this true, do you think, have you had COVID?
No.
Lucky man.
Not lucky man. T-cell man. I have a T-cell in my body that protects me from the nucleic capsid.
Where do I get one?
That trial was held up by the FDA and by Collins and Fauci.
But you never got COVID because your protector cells were so strong?
Not only a protector cells, if I do get COVID, the virus clears. You want to clear the virus.
Get the hell out of my body.
Get it out.
Wait, I just want to pause here. I know you're in the midst of a much larger story, but this is something I think everyone can understand. So I think I'm in good health. I am in very robust.
Did you have COVID?
I did.
How many times?
One. I never took the vaccine.
Okay.
But I got COVID, knocked me right on my butt. It was a bad 3 days. Fine. But I don't understand. You're older than I am. How did you never get, I just want to get very specific. Like, everyone on the planet got COVID.
Okay, so let me give you some idea. Okay. One, because we understand the implications. My wife, touch wood, also never got COVID because of both of us. So this is the story. We, by that, unfortunately, I relate this, it's a painful thing to me because I relate it to Kobe's death. It was during Kobe's time when he passed away. And at the funeral.
Kobe Bryant, who you were close to.
Correct, very close to. And at the funeral, at his funeral, all the people in the room, and it was, I think, November. And I turned to Gavin Newsom and I said, listen, this is one virus I'm worried about because I was studying this virus. I understand HPV very well and I understand hepatitis. I said, this is not a respiratory virus. This is a dangerous virus. So I went back and I shut down our organization so that we could actually do nothing else but COVID. My entire team of hundreds of scientists on Zoom and everything else around the world. I said, we must go after this virus with a vaccine that clears the virus. And the only way to clear the virus is to have what we call a T cell, an NK cell, the cells that kills cancer cells. And I wrote a paper with Carlsona that says COVID's like cancer and cancer's like COVID, meaning it's immune suppression that causes its spread. And it's immune suppression by the COVID virus that allows it to persist. So the only vaccine that's important is a T-cell vaccine. But, that's what I'm telling you, virologists think about antibodies versus cellular therapy. It's foreign to them to have a vaccine that stimulates T-cells. So I said, I understand that internally.
It's a little weird since in 20 minutes you explained it to me, not particularly high IQ, not a scientist. I understand exactly what you're saying. Why isn't it obvious to virologists? Why isn't that like day one lesson in virology school that the T cells, that the cells that protect you against all potential internal harm, like they're the key?
Because every vaccine so far is antibody based. Dogma.
Dogma.
Blind spots.
Okay. Now we're cooking with gas. Now I understand what you're talking about. Dogma. Blind spots. Nicely put. Okay. I'm sorry. I keep stepping on your story. So you figure out.
You're not stepping because you're actually interpreting as pleasure to me because I don't know what I'm saying sometimes, whether it's going to be so geeky, it gets lost. It's important for the audience for you to interpret. This is what Sanjay did for me in the 60 Minutes. He was brilliant in this. He spent 2 years with me, by the way, doing a little 15-minute piece.
Wow.
Yeah, we'd come to LA, we'd do this, shoot.
Damn, we just had breakfast. That's it. but okay, so you figure out early, everyone's panicked about COVID, okay? But your position is they're panicked for the wrong reasons.
Correct.
And actually, maybe they're not quite as panicked as they should be because this virus could pave the way for cancer because it will suppress the immune system of the human body. So you, in November, you said? When did you?
Right. So by March 2020, we had the vaccine. March 2020. Because I had built a full GMP facility for cancer, using the same vaccine that NCI had already tested for HPV and for colon cancer, a thing called CA. So I'd create this vaccine in which we would educate your body prior to COVID for the treatment of cancer, to educate the T cells to recognize the cancer cell to kill it. That's called a cancer vaccine, but which, by the way, is for the only vaccine in clinical trials today to prevent cancer that the NCI is running using our technology.
Is there any way you can take the word vaccine out and call it something else?
I'm calling it BioShield.
Good. Because vaccine just scares the crap out of people.
I know, because it's not a vaccine in that general sense of an antibody-based vaccine. It's your body's BioShield. So we'll announce it on the show. We're going to call this Project BioShield, which, by the way, in 2004, there was a BioShield Act for national preparedness against radiation, against a pandemic of infectious diseases. So we have the worst thing that can happen to you is to have one dose of radiation will wipe out your NK cells and your T cells. That's how you die.
Yes.
That's how you get cancer.
It zaps your immune system.
It zaps your immune system. So we wanted to create a BioShield. And the BioShield is to educate your body to have these T cells called memory T cells that go and hide in the bone marrow and come out when they need it and kill that cell so it can never do damage. That's the concept. And it's not a foreign concept. We published it with the National Cancer Institute. So by March 2020, I took all our resources. Thank God we had the resources. So that's the sort of gift.
Was this your money?
All my money.
Okay, so I should just say, I alluded to it earlier, but you had a couple of companies making cancer drugs. You owned all of them. I mean, you owned, I think, 100% of the companies. You sold them for $10 billion or something. So, but rather than buy a vineyard, you continued in your work. Is that a fair?
Very fair. You know, as I said to you over breakfast, I had no idea about stocks. So when the two companies were bought, and they were bought for the right reasons, the one company was American Pharmaceutical Partners, and we were making literally close to 1 million vials a day in the United States, manufacturing of 150 different SKUs for every part of the hospital, and was safe for heparin. So Fresenius said, we want to buy you. And we said, great. And then I developed this molecule that was feeding the tumor that could actually activate the immune system to activate the macrophages, called Abraxane. And Celgene said, we want to buy you. I said, great. And the purpose for my selling them was not for the money. Clearly it was for the money, but the purpose of the use of the money to pursue this dream of this astrophysics, to find God's particle in your human body to activate your immune system. That was the purpose of this money. And that's all I've done with the money. I spent about $3 billion of this money. I've not gotten 1 penny from the government. Not even 1 dime.
You're the only one.
Yeah. And maybe that's the freedom and the liberation allow me to say what I can say now.
Yes, that's right. So, again, I keep pulling this away because there's a lot here that's interesting, but how did you not get COVID?
Okay. So I recognized that, so Peter Marks and I had these conversations. So he was the head of CIBA, and I was in pinging him with the science, because this is a biologic. And I was saying to Peter, listen, Peter, I need to show you that we need to create a T-cell vaccine. And he said, well, we don't do T-cell vaccines. Everybody's doing the other vaccines, but great, let's continue.
The antibody vaccines.
Antibody vaccines. And then he called me and he said, we're going to create warp speed. And he's a Star Trekkie and I'm a Star Trekkie and I love warp speed. I said, okay, we got to do this in warp speed. Absolutely. But the only way, Peter, you're going to do this in warp speed, we need, as a country, to have NIH and BARDA fund a trial where we take macaque monkeys, we give them the vaccine, and everybody should throw their vaccine in, because I don't care whether it's not mine or theirs, whoever's vaccine, to clear the virus. The only way to do this experiment, you give the monkeys the vaccine, it's under your control, you have 100 monkeys, everybody gets a set of vaccines, and then you infect the monkeys in a BSL-3 facility with a high dose of COVID, and then you see in their lungs and the tissue that there's no virus after 7 days. Absolutely. That was warp speed. So I was one of 8 of warp speed. Then I get a call, Patrick, you de-warped. You are there. I said, test my vaccine anyway. They did a vaccine test at the NIH and BARDA. It cleared the virus, as I predicted. There was no virus in the lungs and after a big infection. So I said, okay, I'm de-warped. And this was a Francis Collins scheme and Anthony Fauci scheme and Monty Slawi scheme. And one day we're going to talk about the conversation I had with Monty Slawi and what I've learned about Francis Collins in that event. And they were going to go after this antibody vaccine, which is this mRNA vaccine with spike. And I said, this is too important. I told my people, we're going to build our own vaccine with our own money. I couldn't get enough material other than to do one batch. And we're going to do a phase 1 trial. And we're going to inject as many people that we can do in the phase 1 trial. I'm one of them. I injected myself.
And your wife?
And we're going to measure. I don't want to talk about the family.
Oh, of course.
And we're going to measure my own blood. I drew my own blood and tested, and I have T cells to nucleic capsid and to spike, which means if I were to get COVID, touch wood, the T cells, now our memory T cells, would clear the virus. So we then tried, begged, because not for funding even, but for the plastic bags that were now restricted as you grow these things to Pfizer and Moderna, all the materials that you need in a biological facility. Got 0. I've only got 1 batch, so I'm going to South Africa and inject these in patients with HIV, because that's the biggest test you could have. You can generate T cells in the patients with HIV and do this phase 2 and phase 3 trial in South Africa. So we did that. And then I called Peter and I said, Peter,
I'm sorry, what were the results like?
T cells. The people that, interestingly enough, it doesn't say, just so you know, you have to differentiate. Does it actually prevent the penetration of the virus versus the load of the virus versus the clearance of the virus? These are 3 different things. So we think it prevents the penetration, but we don't know, because as soon as it does penetrate, it would clear, so you wouldn't even know. Or the T-cell vaccine. This is anecdotal, but some of the people who got our T-cell vaccine, their family members got COVID. They didn't get it, obviously, the vaccine, and they didn't get COVID from a time while living with their family. The issue of clearing the virus in transmission was the key. So an antibody vaccine may reduce the viral load and therefore reduce death, which is a good thing that President Trump did. But the next generation of clearing the virus was what was needed. And both should have been developed simultaneously. It wasn't.